good evening. My name is Maritza Lopez, and tonight we will be presenting along with Cynthia Scott, Jatan Strickland, and Yolanda Thailand. And the topic of our discussion for tonight is going to be the effects of substances on a developing baby. So a little bit about the topics that we're going to run through. We're going to provide an in-depth review of the effects of each substance in the developing baby, which I'm going to go ahead and talk about. Then Yolanda is going to talk about considering the impact of exposure at each trimester. Cynthia will talk about the treatment programs and curriculum that exist for mothers, expectant mothers. And Jatan will go ahead and talk about the cognitive, academic, behavioral, and social skill implications on children exposed to substances in the community. So before we begin to talk about the effects of substances on the developing baby, I want to go ahead and talk about the overview of each substance that we chose to pick for this topic. So the first one that we're going to cover is alcohol. Alcohol use disorder is defined by a cluster of behavioral and physical symptoms, which include withdrawal tolerance and craving. So alcohol use disorder is a common disorder. There's a 12-month prevalence of alcohol use disorder, and it's estimated to be at 4.9 among women. So the alcohol use disorder runs in families with a 40 to 60% of the variance of risk explained by genetic influences. A 3 to 4-fold increase in risk has been observed in children of individuals with alcohol use disorders, even when these children were given up for adoption at birth and raised by adoptive parents who did not have the disorder. So the overview of cannabis would be, this is a disorder, and cannabis use disorder and the other cannabis-related disorder include problems that are associated with substance derived from the cannabis plant. So it's the most widely used illicit psychoactive substance in the U.S. The 12-month prevalence of cannabis use disorder is approximately 0.8% among adult females. And the third substance we're going to be covering is opioids. So opioid use disorder includes signs and symptoms that reflect compulsive, prolonged self-administration of opioid substances that are used for illegitimate medical purposes, or if another medical condition is present that requires opioid treatment, that are used in doses greatly in excess of the amount needed for that medical condition. So the 12-month prevalence of opioid use disorder is approximately 0.26 among adult females. Physiological dependence on opioids may occur in about half of the infants born to females with opioids use disorder. This can produce several withdrawal symptoms requiring medical treatment. So opioids are a class of drug which bind to opioid receptors in the brain and produce feelings of euphoria, calm, and a state of heightened relaxation. Opioids include powerful illicit recreational drugs such as heroin and opium, as well as prescription drugs such as morphine, codeine, and fentanyl. So now we're going to get into discussing the effects of substances on a developing baby. So when it comes to alcohol, the DSM-5 speaks about repeated heavy drinking in females, and it's associated with spontaneous abortion and fetal alcohol syndrome during pregnancy. Drinking alcohol can increase the risk of miscarriage, spontaneous abortion, stillbirth, newborn death, and fetal alcohol syndrome. And babies with fetal alcohol syndrome have low birth weight, heart defects, facial defects, learning problems, and mental retardation. So since it is not known if there's a safe level of alcohol during pregnancy, the best advice is not to drink at all, of course. Even one drink a day has been shown to have effects on a growing fetus. So cannabis can affect fetal and infant development and may cause miscarriage. Although the effects of cannabis on an unborn baby are still unknown, studies have indicated that prenatal cannabis use is linked to premature births. Small birth size, difficult prolonged labor, and increase in newborn jitteriness. Cannabis smoked by a pregnant woman remains in the baby's fat cell for 7 to 30 days. Smoking cannabis can affect the amount of oxygen and nutrients the baby receives, which may affect growth. Cannabis is never a safe drug. And in addition, cannabis can have long-term effects on infants and children, such as having trouble paying attention or learning to read. So the last substance is opioids. A pregnant woman who uses drugs like cocaine or heroin may have a baby born addicted to the substances she took during her pregnancy. So cocaine is one of the most harmful drugs to unborn babies. It can cause women to miscarry and may cause preterm birth, bleeding, fetal death, and fetal strokes, which can lead to brain damage and death. After birth, a baby who has been exposed to cocaine prenatally goes through withdrawals, signs of which include jitters and irritability. So these babies are hard to comfort and are often unable to respond to their mothers. Cocaine use during pregnancy also may be linked to an increased risk of sudden infant death syndrome, or SIDS as we call it. So now I'm going to introduce Yolanda Tylon, who will be covering the next topic.
Okay, first I would like to say that I was surprised by the research and findings. I was expecting to see a little more specificity. Also, I was looking to see more human research. Professionals discuss the lack of human research is attributed to lack of participants due to ethical issues. The information and research found for humans was mostly inconclusive, and the bulk of the research was based on rats and research conducted externally. One of the research that was done externally was like a study on habituation. This is where they test the fetus reflex to stimuli. In addition, professionals are unable to conclude exactly when or how substance use will affect the gestational stages of birth. Due to the lack of specifications as to when and how substance uses affect the events in the womb, the slides will reflect one another as it pertains to what happens in each stage and how and when substance usage can affect the events taking place in each stage. So the first stage, the first trimester, the birth stages are broken down into trimesters, 1, 2, and 3. Trimester 1 consists of weeks 1 through 12. And in this trimester, this is where the cell division takes place, rapid cell division. This is the development of all the structures and systems: the skin system, nervous system, digestive system, respiratory system, muscle system, and skeletal system. At the end of the 12 weeks, all organs are formed. They are not at full growth, but they are formed. And then reflexes begin. Alcohol affects the fetus. It can cause problems with the brain. It can affect size and structure. Size being abnormally large or small, or it can affect the structure by missing parts or undeveloped parts in the brain. The nervous system can be affected by slow to respond stimuli, which is what I mentioned with the habituation stuff. The heart can be affected by formation. Alcohol can hinder the formation of the heart. There was one study where a baby was born with 3 chambers as opposed to 4. The lungs can be affected because it also affects formation. The infant can have undeveloped lungs. It can cause a hindrance to the development of the lungs. It can alcohol can affect facial features, which can have the individual with smaller eye slits, filter, and upper lip flat. It can affect weight because it causes problems with weight gain. The effects on cannabis is that it affects the brain and the skull. It can cause a hindrance to the growth. It can be smaller than usual. It can affect weight because the weight will be more than usual. And length, it was conflicting information about length. Some studies said that length could be affected, and other studies said that definitely was not affected. And I felt need to put it in there because there were studies that discussed that it could be affected. Head circumference, again, it was studies that said head circumference was affected, and then there were studies that said it definitely was not affected. And the interuterine growth restrictions, this is where the unborn baby is smaller than it should be because it's not growing at a normal rate inside the womb. That is caused by cannabis usage. Then there's congenital and malformation. This is abnormalities of fetal development in one or more organ systems and can occur throughout pregnancy. They may be identified before or after birth. So sometimes they can tell you that this is happening before the baby is born. neurological development processes. This is where the neural stem cell survival and proliferation to the migration and differentiation of both glial and neural lineages, where the different cells go to different parts to perform whatever the different parts of structures. And it also can affect the connectivity and synapses function. Okay, opioids is use of opioids can alter the fetal growth. This is defined in the study by length, weight, and head circumference. When they discuss independence, length, and weight, and lineage, and measure, it was that it could be affected, and then it was conflicting information that it could be affected and could not be affected. It was length is rarely used because of the availability, so they didn't have much to study on how the length was affected. And length and head circumference showed no association with opioid use. Growth, smaller for gestational stage, heart, congenital defects, increased risks were observed for arterial septal defects, ventricle septal defects, and double outlet right ventricle. The central nervous system can be affected. The neural tube defects, which is where the nervous system starts from, and increased risk of spinal injury. The limb abnormalities, opioids could cause club foot, orofacial clefts, all of them not consistent across all studies. So the second trimester is where the body systems and structures continue to develop. So the same processes are happening, except it's no longer developing, they're just growing, the different organs are growing. This is where the first bowel movement occurs, development of sweat glands, the liver and pancreas produce fluid secretion, sucking, swallowing begin. Again, alcohol can affect the brain, nervous system, heart runs away as we get in trimester 2. Cannabis in weeks 13 through 25, it does the same as it will in trimester 1. It can affect the brain and skull, the weight, length is conflicting, head circumference is conflicting, intrauterine growth restriction, length was conflicting information at small for gestational age, and congenital malformation can occur, and neurological development process can be hindered. Trimester 2 for opioids, which is weeks 13 through 25, it can alter fetal growth, independent length and weight, lineage, and length is rarely used because of availability. Again, these are the same things that happen in trimester 1. We'll move along to trimester 3. Again, the same development problems in trimester 3, which is weeks 26 to 26 to 40. The final development of organ before birth bones are fully developed, but soft and fragile, storing of nutrients, descension into the head down position, rapid weight gain, all organs are developed. However, the lungs continue to mature all the way until the day of delivery. Again, the same effects for alcohol, cannabis, and opioids take place. I'm going to hand it over to Cynthia.
Thank you. Hello, my name is Cynthia. I'm here to talk about the treatment for expectant mothers. To lessen the negative effects of opioid dependence on the fetus, treatment has been given for with methadone. This is what they use as to help alleviate the desire to use the drug. The other drug they give also is buprenorphine, is described as an even better option for women for expectant mothers. Residential substance abuse treatment facilities for addicted women with dependent children. This is a treatment that's also available for women who are expectant and as a substance abuse user. They also have year-long therapeutic and educational programs for mothers beginning with emotional and behavioral needs. And they also have support groups, which is what the expectant mother will need to develop the relationship with the baby, to understand the withdrawals that she's going through, and to be able to care for the baby as a solo parent. Other treatments available is used to stabilize the fetal levels of opioids, reducing repeated prenatal withdrawals. And this is something that affects the baby while the baby is in the mother's womb, while the baby is in the woman's body. They have programs that will help the woman go through the withdrawal system and still deliver a healthy baby. Next, to improve neonatal outcomes, this is a treatment to link the mother to better prenatal care, to the needs for specialized education and services that address social deviancy of pregnant or parenting women. There are also child welfare agencies. They'll be involved with this in cocaine use and psychological and depression therapy. One of the best therapies that while doing the research, I found is attachment theory. They were stating how that's one of the best theories to use on a mother who has been using a substance abuse, have substance use disorder. And that is the best thing that will help her develop a bond with the baby, to learn how to cradle the baby, to have a relationship with the child. Barriers for expectant mothers. Despite the compelling need for treatment, most alcohol and drug treatment programs have been designed to serve adult males, neglecting the special needs of women, the nourishment that women need, additional therapy, mental health that the women need. Barriers to enrollment in treatment programs for women include fear of relinquishing their custody of the children and inability to find affordable quality daycare. Also, socio-demographic factors, overall ethnic minorities, all of these things have to be considered when you're dealing with expectant mother. These are barriers that are in place. The statistics of substance use during pregnancy, this was really, a lot of information came along with this. Substance use during pregnancy is a major health problem in the United States for women and their children. Each year, approximately 15 to 19% of U.S. women use alcohol during pregnancy. These are the statistical rates for women who smoke cigarettes, doing illicit drugs, how it affects the central nervous system, and how the child can be developed, born with growth retardation. These are other statistics of substance use: the nicotine exposure, the short of death, HIV/AIDS is the most serious maternal complication of drug use, and the fetal risk is heightened by the possibility of the vertical transmission of HIV to the newborn. And cardiac diseases, hepatitis and anemia comprise a few of the many additional maternal health complications. The conditions of substance use in expectant mothers. These are in uterine opioid exposure. It leads to spontaneous abortion, low birth rate, neonatal meconium, aspiration syndrome, and prematurity. All of these can affect the baby from the mother doing drugs while she's carrying a baby. Prenatal exposure to cocaine results in similar complications: abruptio placenta, fetal growth retardation. All of the baby's central nervous system, heart, brain, arteries, everything is being affected by this. Infants born to mothers who use alcohol during pregnancy, they are more likely than non-exposed infants to display motor and language skills deficit, hyperactivity. Okay, and that's the end of mine. I'm about to hand it over to Jatan Strickland. Thank you.
Hi, my name is Jatan Strickland, and I want to start my part of the presentation.
A quiet epidemic on the rise, where roughly one baby an hour in this country is born hooked on prescription painkillers their mothers are abusing. These innocent victims face an uphill battle, as we saw when we were invited into one special hospital board in Tennessee. ABC's Juju Chang brings us this tale of hope and heartbreak as part of our division-wide commitment to telling the stories of the invisible among us, a hidden America.
It's noon in the neonatal intensive care unit at East Tennessee Children's Hospital, and baby Grayson, just 48 hours old, is shaking again. He's trembling. Grayson was born with a serious drug dependency because his pregnant mother was addicted to painkillers. Now he gets morphine every 3 hours to cut the pain of withdrawal. Grayson was brought here from a nearby hospital to this special unit for detoxing newborns. Right now, there are 23 tiny patients here going through withdrawal, mostly from prescription pills like OxyContin, Vicodin, or Percocet.
It's like they're inconsolable. I know people probably think I exaggerate when I say they have this very fearful look in their eyes. Well, they do.
Good morning.
Carla Saunders is the head nurse of this special unit.
They'll have really bad tremors, really bad jitters, very bad irritability, vomiting, diarrhea, stomach cramping.
Nightline was given rare access for 4 days and nights to witness firsthand what they see as a new and hidden epidemic in this country, striking the most innocent of victims.
When I started, you maybe had a withdrawal baby once in a while, and then it was once a month, and we got 6 this weekend, all at one time. It's gone from
Can you grab the lights for me?
a
Okay. Hi again, my name is Jatan Strickland, and I will be here to talk about, I am here rather to talk about the implications of substance use disorder. First, let's start with the cognitive effects. Alcohol can impair the vision or the hearing of the infant after birth, impair the ability to comprehend and use language, impairment in processing and storing information. Alcohol exposure surpasses Down syndrome and spina bifida as the leading causes of mental retardation. Cannabis can shorten gestational period with meconium staining and delivery complications. Opioids lower mental abilities, affect attention deficits. Studies show boys are more affected mentally than girls. Impaired learning and memory. Evidence suggests that spatial learning and memory may be tied to the hippocampus cholinergic alteration. Physical effects of alcohol, cannabis, and opiates. Alcohol, in newborn babies, we tend to see tremor and shaking, just like we saw in the video. Small eye opening, slow growth before and after birth, small head circumference, heart defects, kidney problems, and jittery or hyperactivity. Those are according to the Mayo Clinic. Cannabis, physical effects can include cough, respiratory issues, altered memory, and low birth weights. Opiate exposure in utero can cause an infant to experience NAS due to sudden withdrawal. NAS has an array of signs and symptoms, including severe irritability. Now, we saw that in the video, the inconsolableness of the baby, feeding difficulties, respiratory problems, and seizures. This is according to the Academy for State Health. Behaviorally, alcohol can cause attention deficits, hallmarked by prenatal alcohol exposure. However, fetal alcohol exposure is generally diagnosed incorrectly as attention deficit disorder, ADHD. Children with ADHD have difficulties focusing for a long period of time. However, children with fetal alcohol syndrome could focus, but had difficulties shifting their attention from one task to the other. Fetal alcohol syndrome has been associated slower less efficient information processing in school-age children. Cannabis. Cannabis was really hard. The research is still out. So researchers still are not very sure about long-term effects of cannabis. However, according to Harvard Medical School, that when you are around someone smoking, it gets in your system. How much will depend on how close you are to that person smoking. Opioids can cause the baby to have excessive fussiness, stuffy and runny nose, tight muscle tones. We also saw that in the video. Seizures, diarrhea, and trouble sleeping. And that's according to the Barnes Jewish Hospital. Social skills for alcohol, cannabis, and opioids can include prenatal alcohol exposures associated with increased levels of irritability during infancy. When asked by teachers of children that were exposed to alcohol, alcohol was less, the children showed less social issues, but they were more aggressive in the classroom. Cannabis, according to the World Health Organization, more studies again have to be done to determine the social implication of the use of cannabis. Most of the studies on risk and protective factors of cannabis use have been conducted in limited numbers of high-income countries. There is some uncertainty as whether the risk factors apply to low and middle income. Opiate children of parents with opiate use disorder show greater disorganized attachment. They are less likely to seek contact, and they are more avoidant.
So to summarize our presentation, I listed an important takeaway, and that is that alcohol and drug use can have harmful effects no matter who is the user. When a pregnant or nursing woman uses these substances, her baby is also exposed to them. So all substances cross the placenta through the umbilical cord and enter into the baby's bloodstream. So it doesn't matter if you're not pregnant, if you are pregnant. Substance use does have an effect on your body physically, and also in women who are pregnant can affect the baby and the uterus, as you can see throughout our presentation. So I'd like to thank my cohort here for helping me out with the presentation, for coming together and doing this. I appreciate each and every one of them. Thank you for giving us the opportunity to be able to do this. And I also want to mention that we do have references. These are our reference pages. I know we required 5 references, but we have more than 5. So there's 1 and there's 2 pages here. So thank you, Professor, and we will be getting a break.